Hello and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about diastasis recti. So what that is a separation of your abdominal muscles. So this most commonly happens in pregnancy. It can happen after having like an abdominal surgery. I've seen it on a few of my men that had prostate surgery because they do partly go in through the abdomen. It's not dangerous. It's super common. In fact, like a lot of the research says like probably 100% of people will have this to some degree in pregnancy. And I think there's a lot of misconceptions about this. A lot of people have no pain. Like, we used to think diastasis recti and a weak core correlates to back pain, but not necessarily. Some of my patients have no back pain, but they definitely have this. Most people they see it aesthetically, or for some of my like higher level athletic patients, maybe it bothers them. Maybe they can't do some higher level things, although I think you can do anything that you train for, even with a huge diastasis recti. There's a woman, I don't know if she has YouTube, but she has an Instagram. Her name's Lisa Ryan, and she also started another Instagram about called Tummy Tuck Rehab. And she's a personal trainer. She works with women, but she had a huge diastasis recti, and she eventually had surgery. And that's sort of like what she tries to educate about now, was sort of like what to look for, her decision to have that, and how she came to that. But she did high level CrossFit with a huge separation. So having a diastasis recti does not necessarily prevent you from doing anything, and it doesn't necessarily cause any pain or symptoms. But for a lot of people, it just is bothersome. And so the first thing to work on is specific exercises. And for some people, they will need abdominal surgery to help like sew the muscles back together, or maybe the skin. So it's most common around the belly button. And again, if we think about pregnancy, it's where you grow the most. I see it much more often in my like petite moms or women that have a short torso. They gotta go somewhere, or sometimes it's based on how you carry the pregnancy, where your baby likes to sit. A lot of it's genetic, like if you just have like sort of stretchier connective tissue, you might separate more. Or yeah, if you're petite and you have a big baby, things like that. So most of it is out of our control. There's nothing really we can do to prevent it. So it's okay. Most people are going to heal on their own, but if not, there's help. And so let me show you some pictures. So this is sort of like the picture I use. Hopefully it'll show up on the video. So this is normal. So it's a separation of your six pack of abs. So this is normal, your six pack. And then this is the separation. So it's not a tear in the muscle, but it's a widening or stretching of this connective tissue that's down the middle. So this shows it around the belly button. It could be upper, it could be lower, or it could be around the belly button. Sometimes it looks like this picture, sort of like the poofy belly, poochy belly, but not always. And then this picture I like to show people too. So this is the layers of our abdominal muscles. So what separates is this top layer, the six pack muscle, right? If we look at this and this, it's the top layer. But you also have all these layers underneath. You have two layers of obliques, and then you have your transverse abdominis. So what I tell people is we try to heal from the inside out. And then check out this that shows sort of like what it looks like in pregnancy. And then how we test for it is feeling in the middle. And it's a little bit tricky. So one thing I want to share with you that's really interesting is I have an offering that people can come to my office and get checked for diastasis recti. It's like a quick check for a little bit of money. Because oftentimes you don't know, and then I can tell people either, yes, you have it, here's where to start working, or maybe you need to make a whole appointment, or no, you don't. And this girl came to me. She hadn't been pregnant or anything, and she swore that she had it. You know, she started Googling, right? And I think it's really hard to know if you have it or not, if you don't know what you're feeling for. That's why I have this offering that people can come in and get checked. But she didn't have it at all. But the interesting thing that she told me was she is an athlete, she works out a lot, she lifts a lot of weights, and she was scared of doing something wrong and making it worse. So she was like, I quit doing any abdominal exercises and I just did diastasis recti exercises. So there's no specific diastasis recti, but what I work on with people is we start working from the deepest layers, the transverse abdominis, and then we work the obliques and then the six pack. So we sort of work from the inside out to create stability in the core. And this girl that came in, she was like, I noticed more definition in my abs from doing the diastasis recti exercises than when I was just doing regular core stuff like sit-ups, crunches, planks. So I thought that was really interesting that, like, you know, maybe there is something to what we do. And I do think you can have a flatter tummy and more definition by working on the deep layers and not just sit-ups, planks, things like that. So anyway, fun fact of the day. But yeah, so there's nothing you can do to prevent it. It's not dangerous. It often doesn't cause any pain. Sometimes it just like looks funny, or we don't like the way it looks. And then also I think if you are going to do higher level exercise like CrossFit, weightlifting, things like that, you probably do need to work on it specifically so that you have better core stability. So I think that's maybe where it can cause a problem is if you have it and you want to do higher level stuff, you don't want that separation and that weakness because it is a weakness, right? So oftentimes women come to me in pregnancy because they are worried about this, and so they want to know like what's safe, what's not safe, and it can be very individualistic. It's not necessarily like, don't ever do these exercises, right? And I recently saw a pelvic floor PT posting like, these exercises cause diastasis recti, like don't do them. And it was like, oh, so cringy because it's not any exercise. So if you have it, like let's say you're pregnant and you have it, or you're postpartum or whatever, there's probably certain exercises you don't want to do because it's going to make it worse. So we call it like doming or coning or tenting. So imagine if I'm laying flat on my back, and that's what you'll see in this video. You see the doming and coning. So it sort of like poofs up in the center. And if you have a significant diastasis recti, it's going to be obvious. Probably everyone has a little bit, but it's going to poof up. And so what that's telling us is whatever movement or exercise you're doing, that you get that doming or that coning, it's too hard for you. It's too much for your abdominal muscles. So then we need to back off. And so if you're pregnant and you're going through this and you know you're just going to keep growing, then we need to sort of modify what you're doing. If you're postpartum and you see this, that means it's too hard. You're not ready for that exercise yet. So again, we need to sort of back off, start a little bit easier and build up to that. Again, there's no like harm in it. Are you gonna make it worse? Probably not. But you're not gonna help the healing process. So if it's a significant doming, so, you know, I think you can stress less about it. This is one time I think the internet is like, it's good that we like have all this information now, but I think it's too extreme, right? Because when I started my career like 20 years ago, hardly anybody knew what this was. And now it's sort of all over the internet and people are really freaked out. Like, I can't do any exercises when I'm pregnant or early postpartum. And it's like, no, we need to find somewhere in the middle that you can do it and it can get better. And majority of people are not going to need surgery unless they want it for aesthetic reasons. And I also highly recommend, if you think you're going to have another pregnancy, like don't get surgery yet. Do rehab, because I think that's going to benefit you. You know, if you have a stronger core going into another pregnancy, that's going to benefit you. But you don't want to surgically repair it and then it's going to stretch out again. That's sort of useless. And hopefully a good surgeon is going to ask you these kinds of questions, but who knows? So hopefully that helps. Hopefully these video demonstrations, I'll play it one more time, sort of help you to know what to look for and what it should look like, what it might feel like. But let me play this video too that this is in the same like 10 minutes. So this is this mom when she's pregnant and just doing a crunch. That's sort of how we test for it. And you can see the doming, and then I gave her like a few simple cues, and then she could do a crunch without doming. So sometimes it's that simple, and then we got to work on it and work up to harder things. So hopefully that helps you to be less scared. Seek help if you need it. But yeah, that's what diastasis recti is, and I'll link some things below.